Wendy mentioned, I spent
almost 20 years as a music therapist. Most of that time was spent in the pediatric medical setting. And like a lot of you who work as a music therapist, you probably experienced a lot of joy and a lot of success at the work that you did. But I also, at times, felt like I was banging my head against the wall because I felt like music therapy wasn't getting the recognition that I thought music therapy deserved. I didn't always have the vocabulary, I had the research, I had the evidence base, but it felt like sometimes that wasn't enough. And it wasn't until 2013 when I joined the Oregon State Task Force and we got licensure passed that I started to see the big picture and I started to realize the importance of policy in the work that we do. And what I found was that we are trained as music therapists, we have the knowledge base, we know the research, we talk about evidence-based practice, we tell our stories, and then it ends there. And what I realized is that music therapy, evidence-based practice, and the work that we do, the results that we get, go hand in hand with policy. What I'm going to do today is we're going to use the opioid crisis as a backdrop for talking about how important policy is in the work that we do. In order to do that, we need to come down from our music therapy silos and maybe take a ride on a balloon so that we can see the bigger picture. That's what policy is. It's pulling back and looking at the bigger picture. As music therapists, we're really trained, and we do this really well, where we hone in and we focus in on very specific goals and objectives for our clients. That's what we're taught to do. But we also need to take a ride on a balloon so that we see the policy landscape. So let's talk about the opioid crisis. It's a really great example because it is such a salient issue. We're not really talking about it, to be honest. And it's something that is affecting probably the vast majority of us working either in the medical setting or in with other clientele. In the last 24 hours, at least 130 people will have died from an opioid-related overdose. Just look around the room and think that every one of you would be gone. 130 people in 24 hours in one day. It is the biggest drug problem we've had in the United States. When we look at the deaths per year, the death toll is so much larger than any other drug problem that we've had. Compare that to the methamphetamine crisis and the crack cocaine crisis. So it is a public health emergency. SAMHSA, the Substance Abuse and Mental Health Services Administration, did a study in 2016 and estimated that 11.4 million people abused prescription opioids in 2016. And more than 2 million people probably have an opioid-related drug disorder. So you can see the magnitude of the problem and the amount of potential in terms of who we serve. But we know that music therapy is doing great work. We are evidence-based. We are a fantastic alternative to opioid use, or maybe an adjunct to opioid medications in the hospital setting. We know that from the research literature that individuals who receive music therapy have less perceived pain, and there's also evidence that they use less opioids in the hospital. Less opioids means less risk of addiction. Where we're also doing a fantastic job is working with babies with neonatal abstinence syndrome. These are babies whose mother abused drugs in utero. And as they're born, they have to withdraw from whatever drug it was that they were exposed to. And we have some great emerging evidence that music therapy using the pacifier-activated lullaby is helping to reduce the symptoms of this withdrawal. There's also evidence that the medication used for these babies at a very, very vulnerable young age is also decreased when music therapy is introduced. The other beautiful thing that we are doing in music therapy with neonatal abstinence syndrome is that we are the ones to work with mothers who want to do the right thing, want to get clean, they want to be with their baby. And while the medical staff is attending to a baby that is probably screaming and crying at all hours of the day, continuously, the music therapist is really the one to help that mother connect with their baby. And their baby's survival counts on it. It's often a very dehumanizing experience for these mothers because there's a lot of judgment when people think, wow, you did that to your baby. That was not a choice that they wanted to make, and now they want to do the right thing. And music therapists are the ones to help them connect, to make that bond happen. We have a lot of music therapists also working in addictions treatment, and we know the evidence suggests that music therapy helps to engage them in treatment at higher levels. It decreases their cravings for treatment, and also helps to decrease the feelings from the stigmatization of being addicted to drugs. So we're doing fantastic work, we're doing fantastic research. And so how does that apply to what is going on in the opioid crisis? Our government is spending $1 billion to help with this problem. $1 billion. And I think the math that I did was, even if we had 1% of that, that would probably be 130 new music therapy positions. 1% of the money that our government is spending on this crisis. 130 new music therapy positions. That's what it would mean. To look at the landscape of policy, one of the things that would help is on the institutional level. Probably those of you who work in the hospital know about the Joint Commission. They are the ones who make sure that hospitals are following certain protocols and safety and accredit hospitals to basically run. Very powerful organization. But did you know that the Joint Commission this year instituted a new policy on pain management in the hospital? And one of those policies is that every single hospital that is Joint Commissioned, accredited, must provide non-pharmacological pain management alternatives to their patients. Now, if that's not rationale for having a music therapist in every single hospital in the United States, I don't know what is, really. So the intersection of policy and what we do can be really, really helpful in pairing that evidence-based practice and strengthening the work that we do. It strengthens access, it strengthens our credibility. Another part of that Joint Commission is that part of the opioid crisis, another policy that they have instituted is that every hospital needs to do quality improvement studies, and that is to take data on the alternatives and the treatments that they're offering and the effectiveness of those treatments. And so this is a great opportunity for music therapists to demonstrate how effective music therapy is in their hospital. They can go to their administration and say, we're doing a great job with meeting Joint Commission's policies, and I'd like to demonstrate to you how we're doing that. And by the way, I talked about NAS babies, neonatal abstinence syndrome. One of the first studies published documenting the effectiveness of music therapy was a quality improvement study. The national policy, the Department of Health and Human Services has this five-point strategy. I'm not going to go through all of them. But I know as music therapists, you're looking at that and you're saying, okay, music therapy fits there, music therapy fits there, and music therapy fits there, and that's what I want us to be thinking about. The $1 billion, the vast majority of it is going into that first point. About $800 million, I can't even, that's like lottery money to me. $800 million is going into treatment, better treatment. A lot of money going into research. You can find this information. It's a really easy Google search. But I encourage you to do that and take a look at what things are being instituted, where the grants are, where the opportunities are, and where music therapy fits in that policy. So what can you do? You need to be the expert. You're not only the expert at music therapy, but you also need to be an expert at policy. Because the two go hand in hand. They're like two puzzle pieces that need to click together. So we know how to talk about music therapy, we know how to talk about the evidence base, but do we know how to talk about policy? Arm yourself with that information because it can provide a lot of rationale for what we do. And sometimes the evidence itself, as much as we'd like to think that it stands on its own, it needs the policy to go with it to help us attain and help our clients access to what we do. Thank you.